San Diego, this is your Fox 5 News.
It's a growing trend. What some people are doing to boost their backside? You'll hear the pros and the cons. We are back right after this.
Hey, did you know that last year Americans spent $10.5 billion on cosmetic procedures? So this morning we are talking about one particular procedure that is becoming a little bit more mainstream, a little bit more popular than you might think. It's called, they're butt implants. Butt implants. People are doing this. So Dr. Vincent Marin of Marin Aesthetics is here to tell us about this procedure. Doctor, good morning and thanks for being here.
My pleasure.
Butt implants. Yeah. I've heard about this before. Is this really that new?
It's something that's been around a while. There's been it's been recently in the news because there's a surgeon down in Miami who coined a new term, this Thong lift, and what it is that they're actually supposed to using the implant. What they're using is fat from your body and injecting it to give you a shapelier, prettier rear end. So it's something that's been around a while, and so have the implants.
But the difference in the Brazilian butt lift is what I've heard about and we've covered before. So the difference now with this Thong lift is that the incisions are where an actual thong would be, right? Right.
So what he's trying to do is from Miami, and he did some training in Brazil, is that it's kind of the outfit of choice is wearing, I think, a thong on the beach there. And so what happens is that they're taking that incision, or all the little incisions that we use to inject the fat, hiding it along that area so that it's something that's almost imperceptible even in some of the skinniest or skimpiest clothes.
Okay, so in normal language, they take the fat from somewhere else in your body and then you put it back in the buttocks area in order to enhance.
Correct. So what we're trying to do is use kind of liposuction techniques, except they're very gentle. So we have to preserve what we call the viability, how that fat's going to survive. Then what we do is process it, strain it, make sure that it's prepared and pure.
Okay.
And then what we do is re-inject it into the body.
Do you have to have lots of fat on your body in order to do that?
Yes, you do, and that's one of the issues with this, why the implant becomes another option for certain patients. If you don't have enough fat, because it does take a decent amount of volume for this to actually occur, that in thin women that are size 2, 4, they don't have enough fat in their body to actually make a significant change in the shape of their backside. So as a result, those are patients that we'd have to use an implant in.
Okay, and we're showing you some before and after pictures of different patients who have done this procedure. I guess my curiosity would be, if one started to lose weight.
Correct.
You lose fat. So if someone got the implant and then started to lose weight, does that mean that you're going to now decrease your rear end?
You will, and that's some patients will come and say, should I put on weight, should I lose weight, whatever it may be ahead of time. We want patients to be at their ideal weight, and the reason being is that you can change the shape of what we put in. That fat will behave like normal fat after it's been injected. So if you lose weight, you will lose volume where we've put it, and if you gain it, you can put on volume there. So we want patients to ideally stay at a normal weight.
Okay, so if you don't do it the fat way, by removing fat and putting it, this is an implant.
Correct.
So this is similar to like what a breast implant would be.
Very similar. This one's solid silicone. A breast implant is liquid silicone on the inside.
Kind of hard.
And this is it's a little bit firm, and so as a result, this is when we place this implant, it goes in between the muscle. It's flexible, it's soft. But if we put enough of the patient's tissue between the implant and the skin, it can sit in there. It feels fairly firm, but as if you're, worked out at the gym and, had a lot of success.
Do you have to change it, or once you do it, it's done?
No, that implant will stay in place and can stay for life. The biggest issues that we have with implants is if there was an infection or something like that, and that's normal with any implant type surgery.
Is it comparable to a breast augmentation?
Similar,
The
yeah.
price?
Price is pretty similar, as well as the procedure itself. It's just something that we're doing. These implants are firmer, and the issues are less so with this implant than even what we see with the breast implants, which are also pretty low.
I know with looking at the rears of, Kim Kardashian, J-Lo, there's been a lot of people want to achieve that. So this is the fad that you're saying that's in, people want to do it. And they're coming to doctors like you to make this happen.
Yeah, they're coming to see us. I think now that J-Lo's back on American Idol, it's going to probably push it through a little bit more. But it is something, and I think it's an evolving aesthetic. We look at how kind of beauty has evolved over the years, and it's something that changes. And what we're seeing is that this is just as important.
My final question would be, are there any risks, realistically, that people should consider before doing a procedure like this?
Absolutely. It's not for everyone. This is a surgery that we consider to be something that's going to be permanent. We want to make sure the patients really want that. But the biggest risk, pretty much standard with any implant surgery, we've got infection. We can have fluid collections that need to come by. And sometimes those implants can migrate and need to be kind of put back in place.
Well, if you want some more information about the thong lift, we put it up on our website, fox5sandiego.com. Dr. Marin's not going anywhere because this is kind of cool. If you can stick around or DVR it, in the 9 o'clock hour, Dr. Marin's going to talk about some of the craziest cosmetic procedures that people are doing.
Yes.
And one of them, Raul, people are doing it with their eyes. Yeah.
Doing what with their eyes?
We'll tell you in the 9 o'clock hour. Yeah. I couldn't believe it. I couldn't believe it. Okay.
I want to see that butt thing over there. Yes, thank you.